feel very prosaic after listening to Sarah and David to a lesser extent. I have to say, Sarah, it was exquisite. I'm here to tell you that Rosie's egg timer has broken, and so she's told me I can talk for 2 hours and I can show whatever pictures I want to show. Can I have my first slide, please? I've got to kind of do the arm up. And I'll try and remember, no, the slide before that, please. What I'm going to do is, in 15 minutes, talk to you about the face and what it means to us. And I'm going to use pictures of some of my patients who've informed me through their courage, given me immense strength, and taught me a great deal about the face. I'm also going to I'll use some pictures of the patients, but I'll also use some pictures from the Saving Faces art project that I funded, where I had Mark Gilbert paint my patients before and after, and occasionally during surgery. The patients found this cathartic, and it's empowered many patients worldwide. We've moved on 2 slides. I was going to start by talking about, we're going to talk about what's in a face. That was the title slide. No, don't change the slide, I keep my hand down. We're going to talk a little bit about identity, but before that I want to talk about the face as a structural entity, a functional entity. It's vitally important to us. We have our strong skull bones protecting the most important organ in our body. Where are our senses located? Our eyes, our ears, our smell, our taste, they're all in the face. And then it's not a solid organ, it's a hollow organ. As you can see here with the light shining through it, these are the sinuses which allow the air that we breathe in to be warmed and moistened so it doesn't destroy our lungs as we breathe it in. But also it lightens the head so that we don't wander around kind of with our head down, trying desperately to hold it up. It weighs half the weight that it would do if it was solid. Next slide, please. I'll just say next slide. Now, I don't know whether you can see these slides. They look very... can you see these slides? Yes, okay, fine. My last presentation, they changed the colours of the slides, so it looked a bit like oil from the Gulf of Mexico rather than real people, which people in the audience found quite helpful. You're drawn to this young Zimbabwean girl and to the huge tumours that are growing out of her face. These are benign tumours, but they are killing her because they're destroying 2 of the other functions of the face, breathing and eating. This girl is not breathing through her face and her mouth and her nose. She's breathing through the tracheostomy in her neck. She is not feeding through her mouth. She is feeding through a tube in her stomach. So it illustrates the functions. Next slide, please. The form of our face is defined by the underlying scaffold of the bones. You've seen the bones, but then overlying the bones and attached to the bones are the facial muscles. This poor young woman has Mebius Syndrome. That means she has bilateral facial palsy. She can't move her face. So on your left-hand side, she's static, and on the right-hand side, she's trying to move her face and failing miserably to do it. Our facial expression, our social signaling system is related to these. Next slide, please. And then we've got the facial skin. We've got the complexity of it, the 3-dimensional complexity. Look at those angles, those acute angles. Feel your own face and feel the thickness of your cheeks and feel the thinness of your eyelids. And look at all the creases. Next slide, please. And then, of course, we've got the hair on top of it. This is my son. And he looks a bit odd on the right-hand slide, and that's because we've artificially removed his eyebrows. I didn't go into his bedroom one night and kind of shave off his eyebrows so I could take a photograph like that. That was done on a computer. But it does show that, it'd be very odd if people had hair sprouting from the middle of their nose. Actually, I have one hair sprouting. I better pluck it out. But the point is that, hair is vitally important to us. To men, it's important. I'm losing it from the top, and it's growing in all sorts of areas that I don't want it to grow in. And so hair is also very important. Next slide, please. We don't wave that thing around, Rosie. I'm not up to 15 minutes yet. Anyway, there's something. Let's think about our faces now, though. We've seen it as a structural entity. We've seen how it's formed and the movements that are crucially important to it. But let's think about how we perceive ourselves. We actually don't perceive ourselves as others see us. We look in a mirror. That is a mirror image of ourselves. It is not a true image of ourselves. We have a photograph taken of ourselves. It's 1/250th of a second. Bang, it's gone. It doesn't capture us. That's one of the reasons I employed the artist to paint the patients, so that he could capture the emotional transformation as well as the physical transformation, because he spent a lot of time with the patients. And this is an extreme form of it. Max doesn't have this condition, but he kindly allowed me to use his photograph because he looks exactly like somebody with dysmorphophobia. These people have the extreme form where they may be incredibly good looking, but they perceive themselves as hideously ugly. And they seek surgery after surgery after surgery, when in fact that is the last thing that they need. So thank you, Max. You don't have dysmorphophobia, but you look exactly like a dysmorphophobic. Next slide, please. The age is crucial to our attitude to our experience, our experience of our face, how we feel about our face. Children. This is a young child, Rebecca from Glasgow, who has a blood vessel tumour on her nose. Now, it's a bit dangerous because if she bangs it, it may bleed profusely, and also it's interfering with her vision. What's interesting, and we've done research on the parents of these children, and we've asked them questions about the attitudes of other children, the attitudes of adults, the attitudes of themselves and their family. These parents grow to love the children like this. This usually starts as a little red spot on the nose, and it grows rapidly over a period of 9 months. And so Rebecca's 2.5 years old, and and what will happen is that as she goes out with her mother, other adults will say, "How dare you take that child out? You're terrifying everybody around, and why haven't you done something about it?" And other children will come up and poke it. Can we have the next slide, please? So here's another example of a blood vessel tumour, but buried underneath and growing in a difficult area to operate on because it's wrapped around the facial nerve and may bleed when we operate on it. But the other children will come up and poke it and out of curiosity. You know, we all want to poke it, but we don't go up to people on the tube when we see it and poke it. But children have that kind of feeling that they can do that. They're curious. The parents themselves feel adoration for the children often. And very often the parents disagree over whether the child should have an operation to remove it. One parent says, "We must remove it." The other parent says, "No." And sometimes they suffer a grief reaction when it's removed. But of course, the child and everybody else around feels and behaves much more normally around the child afterwards. Next slide, please. Now, let's think about our teenage years. Do you remember that spot? That acne spot on your face that crippled you for days? That you wouldn't go out because of that acne spot? Just think what it's like if you're like Rhonda, who at the age of 11, her face started growing in a strange way related to the rest of her family. Her chin's growing across to the right, her nose is growing across the left, her chin is starting to jut out. Just everybody in the room, put your jaw forward and turn to look at the person next to you. Now, do we think that we look less intelligent with our chin forward? Yes, we do. Okay. We've actually done studies on other teenagers because these people come to us, these teenagers who've been, they're going through a maelstrom in their lives. They're not only is their face changing dramatically, but they're changing from childhood to adulthood. They're trying to form their characters. It's vital. They crave the support of their peers, and if they look the least little bit odd, they're rejected, not only by their peers, but also by their teachers. We actually did studies on these people before and after surgery. What we did was we showed a panel of photographs of normal people and mixed up with these patients before and after the surgery. And we found that that their judgment that they were making on other people's judgment of them was absolutely spot on. What we found was when their peers were looking at these photographs flashing across the screen, staying there for 30 seconds, they were asked to judge them on attractiveness. Well, it's obvious that she looks more attractive on the right than she does on the left after she's had her cheekbones fractured out and her upper jaw fractured forward and her lower jaw moved across and fractured. But before the surgery, she was perceived as being less intelligent. She was perceived as being more violent. She was perceived as being less friendly, less honest. We didn't operate to change her honesty or her intelligence, but afterwards, according to the peers, when they were looking at these photographs all jumbled up, they judged them as being more intelligent, more honest after the surgery. So the misjudgment that they perceive from their peers and their teachers is exactly right. They are suffering this. And we might think of this as cosmetic surgery. It's a bit tough to have this kind of surgery, fracturing your facial bones and moving them all around, but they're exactly right. They are suffering this misjudgment and underestimating their potential. And these people gain in financial potential, emotional potential, and psychological potential after the surgery. Next slide, please. Unfortunately, when people get older, they don't come to us with those kind of problems. They have suffered the slings and arrows of outrageous fortune with cancer and trauma. So this is Henry, and I learned a huge amount from Henry de Lotbiniere, who was a medico-legal barrister. He came to me after he'd already had surgery and radiotherapy for a cancer. The cancer recurred, and this is after my first operation on him. He was an incredibly handsome man. He actually didn't want to be a barrister. He wanted to be James Bond in the films. And in this first operation, I took away his left cheekbone, I took away his upper jaw, but replaced it with a extended dental plate. I didn't put any bony reconstruction in there. Over a period of 15 years, can I have the next slide, please? Over a period of 15 years, we did 14 operations together. And over this period, he continued to practice, he continued to play cricket, he continued to windsurf. Where I'd say to him, look, there's no textbook for this operation we're going to do. And he'd say, come on, let's do it. We've got no choice. And he'd go ahead. When you look at this portrait of him, you see the power of the man. You see the hands, the insouciance. Courage doesn't begin to describe it. It is, you know, I don't know the word for it, but courage, it's more than courage. It is over and above that. And he has empowered people around the world. Next slide, please. If you're talking about different cultures, here's an example. Does the face mean different things to different cultures? This is Mazida. She's a little Bangladeshi girl from the East End of London. Her mother wears a full burqa. And on the left, you see her with a malignant yolk sac tumour, which has already blinded her in her right eye. She's finished chemotherapy. The tumour's still there. And after I removed the tumour and she came to Mark to be painted, the parents put a little pink ribbon in her hair, dressed her in a green velvet dress, and here she is with a Mona Lisa smile. I think she's better than the Mona Lisa smile, actually. And whenever that's been shown around art galleries in the UK, the parents followed that and wanted it to be shown and wanted their daughter to be seen. So they're incredibly proud of that. So I think the face is important in all cultures. It isn't just in our culture. Of course, we think that Western cultures have an undue preoccupation with the face. No, all cultures do. Next slide, please. So, we've talked about the static face. Lombroso, in his 19th century work, felt that he could tell us criminal faces, and we know from Todorov that we make judgments on people in 1/10 of a second. Are they good? Are they bad? Do we want to spend time talking to them? Or do we not want to spend time talking to them? And here we see a really great-looking guy. Wouldn't we like to have him round to dinner? Wouldn't we like to spend time with him? And now we know OJ is not a particularly nice guy. But good-looking people, as you've seen from the research we conducted earlier on, are given all sorts of leeway. Next slide, please. But of course, we've been looking at static faces. And really, I could stand here, as I showed you with the woman with Mebius Syndrome, and make no expression at all, and I'd be incredibly boring. The point is that we're using our face to deliver expression. It's our social signaling system. So are we discomforted when we see people who cover their face? We are. We don't want our doctors and our lawyers to be like that. And of course, in the UK jury system, jurors think that they can tell whether somebody's being mendacious by the hesitation or the slight blink. And so we want to see faces. And the truth is that we can actually, if we see somebody's face, we can, if we spend time with them, we can reverse that 1/10 of a second judgment. If we spend 5 minutes with somebody, we may be bored by people who we're initially attracted to. We may be attracted to people who we're not initially attracted to. Next slide, please. I just want to talk a little bit about surgery before I finish. What we try and do is hide incisions. So on the left, you see I've split the jaw. We're looking at the back of the throat, taking away a tumor. And here's the young woman on the right. And we're trying to hide the incisions. Next slide, please. In this case, we've taken away the whole of this woman's right lower jaw. We've taken away the base of her skull. And we've reconstructed her. And she doesn't look too bad. But that's not good enough. Next slide, please. This woman wants to be kayaking. She wants to be climbing mountains. This is not before the operation. This is after the operation. So the bar is getting set higher and higher and higher. Next slide, please. So then we have a patient like this. This is Addy, who was flown over from Nigeria, who had the lower part of his jaw shot off. He also lost the upper jaw. He lost his lower lip. Next slide, please. So with our modern technology, he says, that's what I want to look like. Or rather, he doesn't say that because he can't speak. His wife says that. That's what you've got to do, okay? So next slide, please. A couple of the operative slides have been removed. But essentially what we do with modern technology, we kind of make a model from the CT scan. This is not made from any impressions. We then carve out a jaw. That's with a bit of putty, plasticine, kind of working your way at it. And then we bend up a reconstruction plate made of titanium to the right shape, so that when we go in to do the operation, and we use special proformers to tell us that we're going to drill in the ends of the bone correctly, so that when we go in, we're going to put the bone that we're taking from elsewhere in the body in the right place. Next slide, please. So, next slide, please. There he is. So what I do is I put the plate on, I take bone and skin and muscle from elsewhere in the body, I put it in, carve it to the right shape, join up the artery and vein, which are about 1 or 2 millimeter diameter, which are supplying blood to all this tissue, and join them to the carotid artery and jugular vein using a microscope. Next slide, please. And there he is after one operation. I should also say that one of my former juniors, who's a dentist in the West End, comes along and puts in the implants and the bridge, so that's done straight away. And we're the only place in the world doing it at the moment, thanks to the dentist, not thanks to me. So he's not happy with this. Why is he not happy with it? Because his skin is from his back. It isn't the same. Okay? So we're still not perfect. It's not bad, but it's not perfect. Next slide, please. So this is pretty horrible. Close your eyes to the left-hand one, because I'm going to leave the right-hand one. The left-hand side is my patient who attempted suicide and shot off his lower jaw and his upper jaw and his nose. He preserved his eyes. Just look at the one on the right. This is the first full face transplant done in Spain earlier on this year. Actually, when you look at it, it's only the central part of his face that is affected. The outer aspect, he's got his muscles, he's got his skin, his own skin. It's working. Next slide, please. So I'm a bit puzzled by this. This is the face transplant guy who can't move his face, may never be able to move it perfectly, and looks very much like a mask. This is my guy who doesn't look anywhere perfect, and we've taken bone and tissue from his own body to reconstruct him. And you can see the skin on his nose is different. We've done a reverse facelift to bring his face forward to recreate his lips. And we've used bones from elsewhere to put the scaffold in underneath. I think that the problem with this guy on the right is he's going to have to take immunosuppressant drugs for the rest of his life. He's going to have an increased risk of cancer. Where are we going to get the faces from? There are all sorts of issues with face transplants, and I'm really proud of Bernard Devachel and Sylvie Testellin, who did the first face transplant in France, because they're studying the changes that people feel about identity, recognition, and so on. Next slide, please. So, there are better ways. Tissue engineering. Let's have a Julia Child's recipe. Only 2 more slides. Julia Child's recipe. What we do is we get some cells from the patient's own hip, stem cells from the patient's own hip. We make a model of using some material which the body will break down itself. Let's say we're replacing the skull bone. We can use the CT scan to make that model. We put it in. We sprinkle on a bit of cells, we sprinkle on a bit of genetically engineered protein, and lo and behold, we leave it for 6 months, close it up, Nigella Lawson, here we are, Julia Childs, we've got the bone, lo and behold. That's the way forward. But also, we must remember that happiness and contentment and success don't necessarily come from having a great face. So, on the left and on the right we have a young woman who was in a horrific car crash and she's been left with scarring all over her face, but she's happy and fulfilled. The guy on your left doesn't go out during the day, only goes out shopping late at night because he's hideously disfigured. So, happiness and contentment doesn't necessarily relate to your facial appearance. It relates to many other things. And it's not enough for us to try and achieve success surgically. We have to have psychologists to help us to bring patients to more than just surgical success. Next slide, please. I just want to show this before I show the final slide. This photograph is an education to me. This is the daughter of a very well-educated woman who has been to see Kawamoto in Los Angeles, McCarthy in New York. She's been to Boston. She's been to every single craniofacial unit in this country. And this child, who is now 10 years old, still has a tracheostomy and has never had any surgery. And the reason is because every place that she has gone to, they have said, no, we wouldn't do it that way, we'd do it this way. And there is no evidence base to determine what is the best treatment for this patient. So the mother is like a rabbit caught in the headlights. She cannot make a decision for her child. What mother could? You don't want to make the wrong decision. Once you've had the surgery, that's it. So next slide, please. And that's why I set up the Facial Surgery Research Foundation to improve the evidence base for facial surgery, and that's much more important. I've got lots of colleagues around the country who are participating with me in the research, and that's far more important than any of the individual cases I do. Thank you very much indeed.